Before I recognize the gentleman from Ohio, I want to inform the members that votes have been called across the street. I intend to call a recess following Mr. Miller. 5 minutes of questions to call the committee back. We'll call the committee back in order immediately following the vote series. I now recognize the gentleman from Ohio for 5 minutes.
Thank you, Mr. Chairman. Thank you to our witnesses for your time and testimony here today. I'm pleased we are holding this important joint hearing on the capacity of Medicare Advantage, or MA, to deliver quality health benefits to America's seniors. Across our nation, more than half of Medicare beneficiaries choose Medicare Advantage in relation to traditional Medicare for their coverage of choice. In my home state of Ohio, nearly 60% of Medicare beneficiaries are enrolled in MA plans. Ohio also has one of the most robust MA markets in the country, with plans available in every county and more than 36 plan options for beneficiaries to choose from. As we strive for higher quality care and more efficient healthcare system, we must acknowledge both the valuable benefits and the challenges of Medicare Advantage, many of which we have heard about today. One of MA's core goals is to provide beneficiaries with better health outcomes at a lower cost compared to traditional Medicare. Reported results among many plans include lower out-of-pocket costs, 1/3 fewer emergency room visits, and a 29% reduction in avoidable hospitalizations. However, concerns remain, particularly around administrative burdens that can delay care and impact quality. Bon Secours Mercy Health of Ohio reports higher denial rates, almost twice as longer provider reimbursements, and increased administrative burdens. One of the concerns that impacts my district is prior authorization, and last year, Cleveland Clinic alone spent $25 million to manage such requirements. I am heartened, however, by CMS collaborative efforts and will closely with my colleagues deliver to support prior authorization reform to enhance healthcare efficiency. It's my hope that through this hearing we can build upon MA contributions and strengthen care for patients and viability for the healthcare system. Dr. Miller, in your testimony, you echoed concerns raised by Dr. Basil regarding prior authorization and its impact on Medicare Advantage patients and healthcare providers, which focuses on process improvement and reducing burden for physicians, hospitals, and other healthcare providers. What recommendations do you have regarding prior authorization or other administrative burdens to enhance the quality and efficiency of care?
Say make it easy for clinicians and health systems to get the data to the plan. So don't, all these unnecessary steps, fax machine, I mean, I haven't seen a fax machine in someone's home for 20 plus years. And the idea, you know, I had a prior authorization and I had to make a phone call, like me as the patient. It's sort of ridiculous. So the health plan industry can adopt sort of basic IT processes that the auto insurance industry has for, say, car repair, that the life insurance industry does, that, you know, warranty claims for cars, like all of those basic IT operational processes. Someone in these businesses needs to sit down, map out the steps, and solve the problem, so that way we're not sitting here complaining about it. Because it's okay that it exists as a process, but the friction in that process needs to be addressed, and it can be addressed.
Thank you for that common sense answer, which I very much appreciate. And also, I could have used your help when we had an oversight hearing probably a month ago with the IRS. They also use fax machines that are completely outdated, and they're 1960s technology. And by the way, they are not safe and they are not secure at all. So be that as it may. Dr. Basil, I continue to hear concerns about Medicare Advantage's impact on vulnerable rural hospitals. How can Congress protect and strengthen access to critical innovations in coordinated care, such as in-home care for seniors, especially those in rural areas?
Yeah, so it goes back to, you know, the transparency over the approval process. And, you know, I absolutely support the efficiency of the process, but also the transparency in the approval or more importantly, the denial reasons. You know, you ask one day, you might get a different answer than you asked the next day. You talk to one medical director, you're going to get a different answer from a different medical director at the same plan without knowing why that decision was made. And so certainly the efficiency is one aspect of that, but the transparency of how those decisions are made. You know, it was brought up earlier that I think AI can really add to the efficiency, but I do worry without the transparency, then you don't know, well, how did the AI decide upon that? And so how am I supposed to make better decisions if I don't know why that decision was made?
I really appreciate that. With the strides in technology that we're seeing, you know, maybe we're there yet, maybe we're not there, but it's my hope that we can get there that day to where you can achieve and we can get that transparency across the board so people know that they're not being taken advantage of one way or the other. Thank you very much to our witnesses. Thank you, Mr. Chairman. I yield back.
Thank you, Mr.